Good morning, everyone. My name is Chip Partner. I'm the Assistant Vice President for Communications at the University of Rochester Medical Center. I'd like to thank our friends in the media for joining us today for a media availability with our colleagues at Rochester Regional Health. We're joined at URMC by Dr. Mike Apostolakos, the Chief Medical Officer of the University of Rochester Medical Center, and Dr. Paul Grayman, an epidemiologist and the Chief of Infectious Diseases at URMC. We also want to thank our ASL interpreter, Will Hayes, for joining us today. And with that, Veronica Chiesi-Brown, I'll ask if you want to introduce folks on the Rochester Regional side.
Hi, we have our Chief Medical Officer, Robert Mayo, and our epidemiologist, Dr. Emma Leschel.
You can turn it up on the computer.
All right, thank you, Veronica. What we'll do, similar to the WXXI virtual news conferences, Dr. Apostolakos has a few words. We'll ask Dr. Mayo if he'd like to say a few words. Then we'll open it up for questions, and I'll just ask in the order of journalists who signed up. We'll ask you to ask one question and a follow-up, please. Dr. Apostolakos.
Good morning. I'm Dr. Michael Apostolakos, Chief Medical Officer for the University of Rochester Medical Center. I'm joined here by Dr. Paul Grayman, who is our Chief Epidemiologist and Infectious Disease Expert. I want to thank the media for joining us today for virtually for this announcement. On Friday, our colleagues at Rochester Regional joined County Executive Bello in UR Medicine to announce our surge capacity plans. The efforts are making collaboratively to ensure we have the hospital space, staff, and equipment to treat an expected surge in COVID-19 patients. Since then, both systems have seen a modest increase in cases, but we remain well within our phase 1 capacity, able to treat patients in the hospital space freed up by postponing non-urgent procedures and appointments. Today, we're here to talk about the next step we are taking to slow the spread of the disease and improve safety. A universal masking strategy that will take effect in all UR Medicine hospitals beginning at 7 p.m. tonight. Before we talk about that, I want to remind everyone of some basic facts we all should keep in mind. First is that the spread of the novel coronavirus can be controlled. More than 90% of the patients we have tested so far are not infected with the virus. A second point is that more than 80% of COVID-19 cases are not serious. Most people infected with the novel coronavirus have mild symptoms and are able to recuperate fully at home with little or no medical intervention. As with the flu, the people most at risk for serious illness are the elderly or those with immunocompromising conditions. Third, the large majority of patients who do become seriously ill requiring hospital care also make a full recovery. Both of the major health systems are taking steps to make sure our hospitals are prepared to provide safe, high-quality care to patients who need it. Finally, the public can help us. That brings me to the announcement we want to share today. Beginning at 7 p.m., UR Medicine will adopt universal masking in all our hospital settings. That means that faculty, providers, staff members, vendors, and visitors all will wear masks while in hospital facilities. This includes all the hospitals in the UR Medicine system: Strong Memorial and Highland Hospital, FF Thompson in Canandaigua, Noyes Memorial in Dansville, St. James in Hornell, and Jones Memorial in Wellsville. I want to be clear that this new process applies to our hospital facilities and patients and visitors, and not to patients and visitors that visit our primary care practices or ambulatory clinics. In those locations, we will continue to screen all patients and visitors. Anyone who has symptoms that could potentially indicate COVID-19 will be given a mask before entering the clinic. People who do not have symptoms will not be asked to wear masks, but we can offer one if it makes them feel more comfortable. I should also make it clear that not everyone will need a brand new mask every day. People who don't work directly with patients who are likely to be infected will be asked to reuse their masks unless it is soiled or damaged. This will help us maintain an adequate supply of masks for our patients and frontline staff while increasing protection for everyone in our hospital facilities. We're going through a lot of changes these days, and I know it may seem alarming to enter a hospital where everyone you see wearing a mask. We want to assure you that the mask doesn't mean you're in danger. It means we are taking every precaution to keep everyone safe. As I mentioned earlier, the public can help us. The demand for services will determine, the demand for services will be met by our resources with PPE, with surge capacity, with space, if the public continues to take this seriously, if they continue to practice social distancing, if they continue not to congregate in crowds. We can slow the spread of this coronavirus. We will have plenty of PPE to protect our staff that are heroically taking care of the public, and we will have enough bed space, enough ICU space for our critically ill. With that, I'm going to stop and ask Dr. Mayo if he would like to say a few words.
Dr. Apostolakos, I appreciate you returning to those foundational principles and facts that are so important for all of us to stay in mind or to keep in mind. It's very true that social distancing remains a fundamental and vital principle in reducing the spread of COVID-19 and keeping each other safe. So hang in there, everybody, and continue to remind your friends and your family and coworkers. Hand hygiene, of course, remains vital, and as well as environmental cleaning. So all of these steps remain fundamental and our primary effort against the COVID-19 pandemic. We have partnered with the University of Rochester and continue to partner with them, and we also, as a health system, are implementing a broad masking and personal protective equipment policy starting tonight at 7 p.m. So we have messaged this to our team members. We will continue to follow our current policies on visitor restrictions, as well as restrictions on visitors who are symptomatic in our inpatient settings. So all of our team members will be expected to be wearing face masks throughout the course of their day. They will also wear face shields in certain clinical settings. We look forward to our team members continuing to do all that they can and are appreciative to their continuous efforts day by day in limiting the spread of COVID-19. As Dr. Apostolakos mentioned, we remain very concerned about the spread of the disease, and the number of cases is remaining manageable within our systems, but we cannot let up our efforts along these lines. So thank you very much, and I'll turn the time back to our moderator.
Thank you, Dr. Mayo. And now we'll open up for questions from the media. And first on our list is Kayla Green from WROC Channel 8. Kayla?
Hi, yes. So I have a question specifically for the U of R, just about the man who was visiting his wife in the maternity ward and ended up hiding his symptoms. I was just wondering if you guys could talk about maybe what kind of precautions you're taking since that happened, and maybe if you could just run through a little bit of what happened, and like I said, how you're kind of preventing that from happening again.
Yeah, you can.
Kayla, I'll ask if we can stick to the subject of universal masking today. If you want to contact me offline, the new visitor policies are best discussed with our OB department.
Sure, no problem. I understand. Then in that case, yeah, I'll ask a question on this topic then. So as far as the masking, I know that since now everybody's going to be wearing masks, as you said, are you guys concerned about a shortage, or what are you doing to make sure that there's going to be enough?
Yeah, what we're doing to make sure is we're checking our supply chain very closely. And right now we have an adequate supply of surgical masks in order to implement this policy. We check this supply twice daily. We believe that masking now will help flatten the curve of people getting COVID-19. This will, in effect, decrease the need for PPE in the future. But this is indeed a balancing act. And we feel at this time, with the prevalence of the disease rising, is the right time to start masking in our hospitals where we have staff. We've cut down on visitors, but many staff and faculty working together. The future remains unclear as to what the needs will be, and that's why I continue to implore the public that social distancing is becoming increasingly more important. The less cases we see at a time, the more our PPE supply lasts, the safer our frontline workers are, and the better we can take care of patients. And once again, this is a life and death decision people are making in the public about whether to maintain social distancing or ignore the pleas of government officials and hospital officials.
Thank you. Now, Jennifer Lewke at WHEC Channel 10. Jennifer, are you on?
Yes, I'm here. Can you hear me okay?
We can hear you fine, and if this is a general question, we should probably direct it to Dr. Mayo and Dr. Lesho at Rochester Regional.
No, I actually have just a general question for both systems. We have started to hear from nurses, particularly in the UR system, that are being told that they're going to have to reuse their mask for as long as a week. They obviously have some concerns about the safety of that. Have you taken that into consideration, and how do you respond to that?
Yeah, I can address that. The use of masks really depends on where the mask is being used and how it's being used. So there are not absolute limits on the time period that a mask can be used, as long as it's clean, it's dry, it's in good condition. So a mask can be used for general purposes throughout the day and even for a number of days. But as soon as a mask looks like it needs to be replaced, it should be replaced. There are other situations where we're taking care specifically of COVID-19 patients. And in that situation, masks must be worn only for one encounter. That is, they need to be continuously replaced. Now, we have ways that we can extend the life, if you will, of masks used in that way. One is by wearing face shields that cover the face and also protect the mask, so that the mask can be worn for a longer time. Another thing that we're doing with those special kinds of masks, which are worn taking care of COVID-19 patients, is that we started a process to disinfect those masks so that they can be safely reused from day to day and be reissued to the same person who used the mask on the previous day. So that's something we just started doing yesterday. We're getting that process ramped up, and we believe that will provide us more masks available if we're able to reuse them in that safe way.
Dr. Lesho or Dr. Mayo, would you like to comment on the same question?
Sure, Dr. Lesho.
I would echo what Dr. Graham has said. At Rochester Regional, we are also implementing face shields that actually cover the entire face down to the bottom of the neck. We are encouraging the use of these for all direct patient encounters. In addition, we work closely with our infection control department and our education department to have developed reuse and discard criteria. And if any of the staff members feel that their mask is no longer soiled or dirty or unsafe, they are encouraged to reuse it. And finally, we're also exploring creative solutions and creative yet safe solutions for looking at mask disinfection, sterilization, and reuse with our operating room colleagues and their sterilizing capacity.
Dr. Lesho, you're off camera. If you could like join Dr. Mayo, that would be great, or get a little closer to answer because we're not seeing you. And I'll just ask my follow-up now. Are these all N95 masks, or is it a combination of masks depending on the department?
So to reiterate, what we're taking the steps for is actually very similar to what the U of R is doing. So we're issuing face shields. We're also issuing detailed reuse criteria, and we encourage staff members to look at that and discard their masks if they meet any of those criteria, such as being soiled, etc. We're also exploring creative ways to sterilize and reuse these masks. And I'm sorry, could you repeat your follow-up question?
Sure. Are all the masks the N95 clinical setting masks that offer the best protection for your healthcare workers?
There's debate for which mask offers the best protection, but what is clear is that when procedures are involved that create aerosols, like when patients are being intubated or they're undergoing certain lung procedures, then definitely we use N95. But for the general issue, for what patients and visitors will see when they enter the common areas, they will be surgical or loop masks. But both, we're exploring procedures for both for conservation and reuse.
Thank you, Jennifer. And next we have Tanner Jubenvil from 13 WHAM TV.
Good morning. Do you see a minimum timeline with implementing this? I mean, do you see a time in maybe a few weeks when you say, okay, we should be good, or it's just indefinite?
At this point, the time is indefinite. We believe that that the disease has risen to the point that this will be helpful in helping to prevent the spread. Our university, as well as RGH, are looking at models to try to estimate what the amount of patients we'll see and the amount of hospital space we'll need and how much PPE we will need. And depending on how those estimates go will determine how long we'll need to do that. Certainly, if we see a bending of the curve downward, that would suggest that the disease is coming under control. We would make one decision. If the number of patients isn't bending in a positive way, we may have to do other things to prevent the spread of disease. But right now, we believe this is the right choice. It's indefinite at this point, and we keep assessing these things with infection prevention and other experts almost on a daily basis.
Tanner, do you have a follow-up?
I do. So, I mean, we've seen in recent weeks a lot of people trying to make their own and even donate to systems, the masks that is. When people come in, are they going to be given masks to wear, or can they come in bringing one from home? And if they do, is that any concern of what might be on that mask?
So our masking policy applies to our staff and to visitors. Generally speaking, patients will not be masked unless they have signs of COVID-19 or flu-like illness or cough illness. Anyone with those kinds of symptoms must wear a mask, but otherwise patients generally will not be masking. Remember that patients in hospitals for all kinds of reasons are uncomfortable. They may be ill for whatever reason they're here, and having them wear a mask all the time is just an added burden of something that may be uncomfortable to them. So we have to keep in mind that patients are our first priority. but anyone with symptoms must wear a mask.
I might have misspoken. I meant if I'm a visitor, if I want to come with somebody, can I bring my own, or am I given one?
We would generally be giving you a mask. There might be times where people bringing their own mask would also be acceptable. We have to be very careful about preserving our PPE, that is personal protective equipment, including masks. But generally speaking, we would be providing a mask to visitors coming in, keeping in mind that the number of visitors is extremely limited right now, so that's not a large number of people. We've been asked many times about the use of cloth masks, which are being made by people in the community, and is a great effort to help us to have more PPE. Generally speaking, in the hospital setting, we will not be using cloth masks. How those masks perform in terms of protecting the wearer are not always consistent, because masks are made in very different ways when they're made at home. So we're generally avoiding cloth masks in the hospital setting, and we don't want to create too much confusion with too many different kinds of masks.
Thank you.
Next, Wendy Wright from Spectrum News.
Yes, thank you. I had a question in regards to supply. You said that you had an adequate supply at this point of masks. What is that entail? How many and how long do you expect this supply to last?
Well, for our current supply at current rates is somewhere between 2 to 4 weeks, but we have surgical masks, which we're using for the universal masking, coming in on a regular basis. So we feel at this point very comfortable for the near future to have plenty of these masks. Now, once again, depending on what happens in the community with the need for more to care for more patients with COVID-19, those numbers could change almost on a daily basis, depending on the surge of patients.
And from Rochester Regional's perspective, I would answer similarly that there's a very detailed daily inventory. It's really a continuous inventory. There's continuous efforts at sourcing masks, and many sources, I should say there's variability among the sources in the timeliness that they can deliver. Sometimes the amount that they initially commit changes. And so it really is changing on a daily basis. And so it's hard to say that at any one moment of time we have this supply that's going to last so many days. But it is important that all wearers of personal protective equipment are good stewards of that equipment. And hearkening back to earlier comments from Dr. Graham, our employees are being taught that they need to take care of their PPE and extend its use as long as is appropriate.
And Wendy, if you'll ask a follow-up, Brett Dahlberg from WXXI will be next.
Yes, there's been discussion at the national level at the CDC may decide to implement universal masking for the entire country. Is this something you're hearing about? And if that would happen, is that something you would agree with or recommend?
I think that's a public health issue, and I would defer to Dr. Mike Mendoza in the health department for that sort of public question.
If I could offer opinion there, clearly that's a public health issue. But, we tell everybody to distance themselves and to stay home. Hospitals are a place where people can't stay home. Everybody who works here, who needs to be here, has to be here. Our patients have to be here. The few visitors we allow are here. So this is a place where we can't stay home. We have to be here. So we have to protect ourselves, our patients, to stay healthy so that we can continue to take care of everyone who needs to be. So wearing a mask in an environment where there's a lot of people in one building makes a lot of sense. And keep in mind that when you're wearing a mask, it's protecting you, the person wearing the mask, against droplets that might be coming away. But it's also protecting the people around you from any coughing that might be coming out of your mouth. Now, of course, we discourage anybody from being at work if they have a cough. But to the degree that people might just begin to be getting symptoms of COVID and still not be sure that they're sick, might come to work until they realize they're ill, it's possible, we could have people who are here, working here, or visitors, whomever, who might be at the very beginning of a COVID infection. So it helps in terms of protecting others from that person. So masks they work both protecting the wearer and wearing other people around them. And in an environment like a hospital with a lot of people here who have to be here, masking makes a lot of sense. Out on the street, walking your dog, where the nearest people are somewhere across the street, probably there's less rationale for needing to wear a mask in that kind of setting outdoors.
Thank you.
And I'll ask Brett Dahlberg to ask a question. Brian Sharp from the DNC will be next. And Brett, if I think Rochester Regional should get a chance to comment first if you're not directing it to our system.
Great. Yeah, this is a question for both hospital systems. I just want to get a little more clarity on donated masks and homemade masks. I wonder to what extent do you or can you accept homemade mask donations to either meet the increased supply requirements now as a result of this universal masking policy, or to build a stockpile for potential future use if your typical supply chain doesn't work?
Thank you. I'll take that first, and then my colleagues can answer as well. We have a great deal of appreciation for the outpouring of support from this community. It's just been tremendous. And we have received many calls from individuals, from families, from businesses that have said that they have various types of masks. So we are grateful to receive those calls, and we will review the type of mask that they have. Some of these masks were manufactured under certain specifications and meet the FDA requirements, and we can use them right away, and we put them into our supply stream. Others of them may not meet those requirements, and then we can find low risk environments or uses for them. So from Rochester Regional's perspective, we acknowledge everyone's earnest desire to help us out, and we will receive their calls and sort through how we can use the masks that they have in mind.
Yeah, I would agree with Dr. Mayo. We appreciate the outpouring of love and support the public is doing in preparing these masks. Right now, we're looking for the best settings which to use them. For our settings in the hospital right now, we are using surgical masks, but we are collecting the donated masks that are made at home, and we are figuring out the best place to use them. Once again, we thank everybody for their support.
Brett, do you have a follow-up question?
Yeah, I wonder if you can just kind of contextualize this a bit. What is the difference in the newly adopted masking policy and whatever other masking practices you're doing now? What's different between those and your usual mask practices?
I can take that. I'd like to also add a brief comment to what Dr. Mayo, Dr. Apostolakos has said. First, we're very grateful to all the donations and the generosity of the community. And while most of those are indeed homemade or cloth masks, we did have a donation or two, which was actually a standard 3M type N95 masks. And so once those are evaluated for suitability, they were used as well. In terms of how, and again, we're grateful to the donator of that mask. In terms of how this differs, as was mentioned earlier by the university, as the prevalence, as the commonness of this disease increases in the community, and we learn more about it, including the fact that it's possible for people who are without symptoms to maybe be infectious. That's when we implemented the change in order to try to protect as many healthcare workers and as many patients as possible. keeping, as was mentioned, a delicate balance between the stewardship of the mask and so what is different in short is that when you enter a hospital now, almost everybody in a common area will be wearing a surgical type mask, and that was not the case before today.
Yeah, and I would echo that. And I think what the difference is, we have to remember the most common, by far the most common way that COVID-19 is transmitted, and that's by droplets. The reason the 6 feet separation is so important, if someone coughs or sneezes, that's the limit of how far those droplets, which are larger particles, can travel before they drop and hit the surface. If people cough and put it in their hand, then they can touch things and put the virus there. Or if they cough, it can go on the table, it can go on the floor, it can go on a chair, and then someone sits down and touches it, they can pick it up. But once again, COVID-19 on your hands isn't going to do anything. You can walk around and then we all touch our face. You touch your eyes, you touch your mucous membrane, and that's by far the most common way we give COVID-19 to each other, either by directly sneezing or coughing on somebody, and there a mask can prevent the droplets from hitting your mouth and face, or we cough and we put it elsewhere throughout the environment, and you touch a doorknob, someone else does, or a chair, and it gets on your hands, and then you touch your face. By universal masking, that will prevent patients from coughing or staff coughing on each other if they're doing that, and the mask will prevent it, or will prevent when people touch their face, they won't touch their mucous membranes. So we think now the prevalence is such that it's hard to discern, even through intense screening, who's sick and who's not, and who could be developing symptoms that they don't get until they actually get here. So as was said by our colleagues at Rochester Regional, what you'll notice is that when people are together now, they'll have masks on to prevent that person-to-person transmission. The other thing that's occurred in our hospitals as we practice social distancing elsewhere, that this is one of the most dense places. Even with sending so many of our workers to try to work from home remotely, we still need so many caregivers here and people that are essential to take care of our patients that it's hard to practice social distancing on a floor when we're taking care of very sick people. So that's the difference.
Next, Brian Sharp from the Rochester Democrat and Chronicle, and after that will be Nicole Sheldon from the Rochester Business Journal. Brian?
Yes, I was wondering if someone could address specifically for patients, because I'm thinking in like the maternity, or not for patients, I'm sorry, for visitors, how the reuse of masks will be handled. Thinking of significant others in the maternity ward, you'd be there for several days, parents with their children at Golisano. Are they going to be asked to reuse or continually have the mask on, never take it off? And at what point do you change it out, or how do you deal with that?
This is Dr. Lesho. I'll provide an example of how we're considering that as it applies to our dialysis patients. One of the things we're looking at is, so dialysis patients generally wear a mask when their blood vessels are being accessed normally for dialysis, and we've extended that policy to have the masks and the staff be wore all the time. And what we are looking at is, at the end of the dialysis session, is potentially collecting the masks of the patients, sterilizing them, and then reissuing them to the next group of patients. But we're exploring that and other ways to conserve masks and reuse them safely.
Do you have a follow-up, Brian?
And I'm sorry, on the, as far as for visitors who are going to be staying for a number of days, again, people with who are in the maternity ward, visitors with their children who aren't going to be leaving, aren't there for a myriad of hours, but are there for a period of days. How do you handle those masks?
So generally speaking, masks that are being worn by visitors and most of our healthcare workers during the day can be reused. It is only in very specific circumstances where we require that masks have to be changed, and that is in the settings where our staff are taking care of COVID-19 infected patients. That's where we know the virus is there, and we have to be extremely careful about rehandling things like masks. And that's the setting where the wearer, the healthcare worker, does not continuously take on and off this mask. That's where we are now beginning to reprocess masks. So the mask that a person uses can be reprocessed, disinfected, and returned back to that same user to use their own mask again the next day. But for general purposes, for most of us working here, for our visitors, those masks can be worn throughout the day. And they need to be worn all the time when we're in the presence of other coworkers or patients. If staff here go to their own office and work in their own office by themselves, they do not wear a mask in that setting. But in any public place or around other staff and patients, masks must be worn continuously, and those masks can be used for an extended period.
And I will just add that right now, with the visitor restrictions, there's relatively few visitors. For those visitors, when they enter, they will be given a mask. If they come in with a mask, it will be checked at the front to make sure that it's clean and not soiled. And if if visitors are on the floor, the nurses will be checking in routinely. And if the visitor's mask is dirty or soiled, it can be replaced.
Brian, I thought we heard your question, but I got your text. Did we miss what you were asking?
Got that at the end. My follow-up is as far as to be clear on outside of hospitals, clinics, other outpatient facilities, what is the policy for staff there?
So the policy for staff is that all staff and faculty will be masked with surgical masks. Patients, when they come in, will be screened. If they don't have any symptoms of COVID-19, they will not be masked, but if they have any symptoms of COVID-19, they will be masked.
You're talking about our ambulatory.
This is for the ambulatory and clinic areas outside of the hospital.
This is also true for Rochester Regional Clinic. Those staff, they work in clinical areas, they will be wearing masks. And visitors are currently screened by phone before they come for their appointments, as well as at the door, and their visitors also.
Thank you, Dr. Mayo. Next, we have Nicole Sheldon from the Rochester Business Journal, and I see that Will Astor joined from Rochester Beacon to come up next. Nicole?
Hi, yes. I'm sorry, I had some technical difficulties a little while ago, so I sincerely apologize if this is redundant at all. But what methods are you using to sanitize the masks? Because we're hearing from nurses that after a shift, masks are pretty gross. So I'm wondering what sort of sanitizing procedures you're planning to implement.
Yeah, I can address that. If I heard you say that masks were saying that nurses were saying that masks were pretty gross, was that the language? Any mask that's pretty gross needs to be thrown away. Masks cannot be reused if they're soiled, if they're dirty, they're falling apart, if they're gross, as you put it. The process for disinfecting masks that we've adopted here uses a hydrogen peroxide vapor. So the masks are, the used masks are collected. Everyone has the name of the user written on the mask, so it only gets returned to the same person. They are collected, they're brought to a central processing room where all the masks are bathed in this hydrogen peroxide sterilizing or disinfecting vapor for a period of time. And then the masks need to be in fresh air, if you will, in order to allow them to become dry and have no residual odor. Then they are returned to the area where the original person worked, and they can take their mask, which has their name on it, to be reused. We're just in our second day of doing this, so there may be changes in the process as we go along. But we know this has been used at other medical centers. It's also a process that we've used to disinfect other kinds of products for many years. So we're familiar with it, and we think it can be well applied to these N95 types of masks.
And we should clarify, Dr. Graham was describing the N95 masks, not the
correct. The surgical masks are disposed once a person is done using it, whether that's for part of the day or after a number of days, gets disposed of. Those will not be reprocessed.
Okay.
Nicole, do you have a follow-up?
I do. Do you see the universal masking policy expanding to other offices or clinics in the health systems?
We're currently evaluating that. We have a policy that obviously anyone who's ill should not be coming to work. We are working to make sure that all our areas, non-clinical or clinical, have as few people working there as possible, and that they're working at a distance that's safe from each other. But right now, we are currently evaluating that policy for this universal masking and have not made a decision at this point.
This is Dr. Lesho from Rochester. I'd just like to add a follow-up question. Not to get too much in the weeds, but there's probably a safe limit on the number of times a mask, be it an N95 or a surgical mask, can be safely reprocessed. So one of the things we're looking at is tracking the number of times that mask is sent to the hydrogen peroxide vapor. Another technique we looked at and have not ruled out, but are aware that it might shorten the lifespan further, is ultraviolet light. But what we're looking at is for an N95 is once it goes to the reprocessor for the first time, it'll get a dot. When it goes to the reprocessor a second time, it'll get a number 2 dot. And unless we get really desperate, we'll probably not reprocess it more than that until we really need to.
Thank you, doctor.
And Will Astor, do you have a question? Will, I see your name on the list. Are you there? Your mic's muted. It starts.
Okay. I'm unmuted now, I think?
Yep, we can hear
you. Okay. So for those of us at home, is there a safe or recommended way to sanitize masks we're using?
I'll take that. Again, it's not really, we'd probably defer for things outside the hospital more to Dr. Mendoza and for his public health recommendation, but unofficially, I would just use the standard common sense things. I would wash it in hot water, as hot as water as possible, and then dry it on high heat. But other than that, there's not much more you can do. Dry it on high heat, make sure it's fully dried before you re-wear. If you have Clorox, you could wash it with a little bleach as well.
Follow up, Will?
Yeah, different topic, which I'm not sure is something you're able or willing to answer at this time. But earlier, Dr. Apostolakos, I believe, characterized our present state in terms of surge is within phase 1. The other day at the surge capacity press conference, I believe Kathy Parinello said we were entering phase 2. Can we assume from that the trend is still upward? And if so, are you confident that it's within manageable rate?
Well, right now, our number of patients are increasing. We're well into phase 1. I wouldn't say we're entering phase 2, although we are planning for phase 2, phase 3, and phase 4 with the government. So we're planning, right now we're in phase 1. I think I'm confident that we have plans that will maximally use all our available resources, all of our structures, all of our beds to care for as many patients as we can. That I promise you. I would say once again, and I know I sound like a broken record, we can supply a finite amount of capacity. We only have so many nurses, doctors, only so much PPE. This is where the public is crucial. The public, I believe, is increasingly getting a message and helping, but I don't believe everyone is. I read sometimes on social media that this is still, it's not true. We don't have to worry about this. We do have to worry about this. Social distancing is crucial. Use media, use your iPhone, message people, talk to people virtually. Don't get in crowds. Stay away from large parties. Do everything you can, because what's really going to determine this, in my belief, whether we have enough PPE, whether we have enough capacity, no matter what the federal government, state government, and we can do, is going to be determined by the public. And if they can continue and even redouble their efforts of social distancing, I am confident we will have enough PPE resources, enough beds to care for them, and no patients will die unnecessarily because of lack of resources. But this is serious, and the more the media can get this message again and again to the public, the better off we'll all be.
Thank you. Last 2 media outlets we have: City Newspaper. I'm not sure if we have Dave Andriata or Jeremy on the line.
You have Jeremy.
Hey, Jeremy.
And really just a quick question. I caught this for URMC, but not for Rochester Regional. Who's going to be required to wear masks in Rochester Regional hospitals?
Yes, all of our employees working in clinical environments. So anyone that's working in our hospitals and in our clinics will be expected to wear masks and shields.
Okay. And will visitors to your hospitals also be required to wear masks?
Yes, we have very few visitors, as was previously mentioned. The visitor policy that has been implemented not only by the shared decision-making of our community partnership, but also from the State Department of Health, has limited visitors greatly, and there are only a few exceptions to that. So those visitors will be given masks as well.
Okay, great, thank you.
Thanks, Jeremy. And last but absolutely not least, Patty Singer from Minority Reporter.
Oh, pressure's on me now to wrap this up with a scintillating question, isn't it, guys? Areas that you have agreements with, I'm thinking of UR Medicine with Jordan Health, things like that. What's being said to clinicians, staff at these kind of loose affiliates that you work with?
Well, at present, I haven't had any, or I don't know of any formal discussions we've had with looser affiliates such as Jordan and elsewhere. We'd be happy to engage in conversation with them to see what their thoughts on this are. We've reached out, as I said, to Rochester Regional and working together as a community, but your question's a good one, and that's something we should be exploring.
And as a follow-up, at what point would you want even patients in waiting areas in the ambulatory settings to have masks? I know I was in an ambulatory setting and they have, tape on chairs to keep people away. But when you talked about coughing and droplets on chairs and things like that, it would seem that really everybody in any kind of close setting would want to mask up because you don't know who sat in that chair 10 minutes earlier.
Yeah, we are screening everyone for symptoms. So anyone who has symptoms will have a mask on. So there shouldn't be people coughing in the waiting rooms.
All right, thank you, Patty. Thank you, everyone. Do our colleagues at Rochester Regional want to make any final comments before we sign off?
No, thank you very much. Appreciate the opportunity to share our message with the public, and thank the press corps for their efforts.
And I'll ask our friends in the media, this is, as I sit 6 feet safely off camera, it's our first attempt at a Zoom news conference. I'd like to know if this worked well for you or if there are ways that we could improve it in the future, because I think moving forward, we'll be doing more of these. So thanks very much, everybody.
Thank you, everybody.
Thank you. Thanks very much.
Thank you.
Thanks, all.